Hello, everybody. My name is Katie McDonald. I am a licensed clinical social worker. My primary job is at Missouri Psychiatric Center. I am a clinical social worker there working with behavioral health. And I am also an adjunct instructor here at the School of Social Work. I am giving this presentation today to educate all of you up and coming social workers about what is burnout, why are we talking about burnout, and what can we do to take care of ourselves and prevent burnout. I am giving this presentation in honor of Self-Care Week here at the School of Social Work. So why do we need to talk about burnout? Here at the School of Social Work, we take self-care very seriously. We care about you, our students, and your well-being. We also take our own code of ethics very seriously. I think self-care is as much an ethical issue as it is a personal one. It's our job to graduate competent, ethical social workers. Thusly, we need you to pay attention to burnout and self-care. Social work is a difficult field. Although it may seem obvious, it's important to understand that working in this field can eventually lead to burnout if we're not mindful of preventing it. Social workers who perform case management duties are more likely to experience work-related conflicts, particularly regarding caseload sizes and productivity demands, and that negatively impacts job satisfaction. Social workers with clients of diagnoses with severe mental illnesses can sometimes have difficulty seeing progress on a month-to-month basis. Remember, these diagnoses can be chronic and even terminal in nature. This lack of feedback on progress and thusly professional efficacy can reinforce a clinician's sense of failure. Thusly, when we become burnout then affects our service. Healthy, psychologically present professionals offer better support for our consumers than burned out professionals, and our code of ethics calls us to promote the well-being of our clients above all else. How can we do that if we allow ourselves to become burned out? What is burnout? The concept of burnout was originally coined by Herbert Freudenberger in 1974. It then spread through North America and international psychology and research. It's now a recognized diagnosis in Sweden. There is an ICD-10 code for burnout added a few years ago, but there's not a DSM-5 diagnosis here in the US. It was recently declared as an official medical diagnosis by the World Health Organization recently in May 2019, which is a major step forward. I, for one, am hopeful that the American Psychiatric Association will add it to the next edition of the DSM. According to Freudenberger, burnout is a state of mental and physical exhaustion caused by one's professional life. It's a very general definition. This is the working definition I found in a lot of the research I've read on this topic. Edelwick and Brodsky added an important component regarding the progressive loss of idealism, energy, and purpose in helping professionals. Wicks, my favorite author on this topic, wrote, if nothing else, burnout implicitly recognizes that it is legitimate for us in the helping profession to experience negative feelings in this work. Maslach and Goldberg identified three main components of burnout. The first is emotional exhaustion, feeling emotionally overextended with no source of replenishment. Depersonalization, which is cynicism and detachment in response to others, and reduced sense of accomplishment, the decline in feelings of competency and productivity, harkening back to the definition that brings to mind the loss of idealism in the day-to-day work. Although Maslach and Goldberg weren't talking in particular about social work with this diagram, I really liked it. It illustrates the cause and effect relationship of burnout. It shows the antecedents of lack of resources and demands of the workplace, feeding the experience of burnout, which then leads to personal and organizational costs. As a social worker, I would also add harm to our clients as a cost as well. You can think about the workplaces that you've been and see where social work concepts may add to demands and lack of resources, the experience of burnout, and additional costs to organizations, clients, and your personal experiences as well. I wanted to include a slide on what burnout is not. Burnout is not a personal failure. It's not a professional failure. It does not mean you have a lack of skills or a lack of ability. I've been in workplaces before where when experiencing burnout, it's been implied that I have some of these things. And I wanted to make sure to emphasize that it is not those things. There are several types of workplace stress that contribute to social work burnout. The first is that routine stress, the small stressors that build up and eventually cause long-term risk for burnout. Then we have acute stress, which are critical incidents that cause a social worker's distress to exceed their coping capacity. They threaten the social worker's sense of identity, job security, personal efficacy. Some examples of these are bank robberies, gruesome ER deaths, the suicide of a colleague. That is unfortunately something that I've known in workplaces before, or organizational changes. These can cause symptoms of acute stress from the DSM. These are direct first-person traumas and can sometimes ultimately develop into post-traumatic stress symptoms. Then something we hear about a lot is secondary or vicarious trauma. These are symptoms of trauma that social workers experience as a result of work with trauma victims, either physical, such as witnessing a gunshot wound in the ER, or psychological, such as hearing repeated stories of sexual violence. These can cause symptoms that are very nearly identical to post-traumatic or acute stress disorder from the DSM, but you are one removed from the trauma. And then we also hear a lot about compassion fatigue. This is a reduction in a worker's ability to authentically empathize with their client due to feelings of those burnouts. And you can see how this would be a negative impact to the therapeutic relationship and therapeutic progress for that client. There are also a number of risk factors for burnout for social workers. We first have the personal risk factors. These can be things as simple as disposition, personality type, personal history of trauma, workaholism, or an overcommitment to work. This is something I've struggled with in the past myself. And the ability to recognize and meet one's own needs, self-awareness. This is the mindfulness of burnout that I talked about at the introduction to this tape. There's also environmental risk factors, such as working in unsafe conditions, poor security, poor lighting, neighborhood, the acuity of the clients, poor security, and lack of ability to take breaks. This is one that we often hear about with burnout in nursing or teachers, is they're not able to take breaks due to lack of staffing. There's only one person in the classroom. There are also workplace risk factors. These are related to organizational things. So role ambiguity or role conflict. This is a disconnect between personal views of the role and the demands that the organization is putting on you for the role. High caseload demands, lack of empowerment to influence the workplace, lack of autonomy, lack of financial or tangible resources, low pay, which is ubiquitous in this field, is a major contributing factor to burnout and ultimately a reason why a lot of people leave the field. Lack of social support or regular access to supervision, and low pay relative to similarly educated professionals. You can think of many other types of professionals that have master's degrees and doctoral degrees that are paid far and above what social workers overall make. And this is a point of advocacy that we need to do a better job of. So although the signs and symptoms of burnout may seem obvious to all of you as students, I think it's really important to remind ourselves of these signs and symptoms and be more mindful of them in ourselves. I'm sure many of them are going to be extremely familiar to you, and a lot of the feedback that we get from our organizations that we work for are that these things are normal, or sometimes overall society tells us that these things are normal. This is just part of being an adult, and I'm here to argue that it's not. So we have the physical symptoms, which are sleep disturbances, somatic symptoms like headaches, GI problems, increased colds, backaches, unintended weight changes, either gains or losses, weakness, changes in eating habits, Psychological are anger, irritability, and hostility. These can often be important red flags, an increase in anger that's uncharacteristic. Boredom, apathy, guilt, pessimism, anxiety, paranoia, self-doubt, sense of decreased self-worth, poor concentration, low morale. And then behavioral, clock watching, living for breaks, making careless mistakes, absenteeism, increased conflicts at work and at home, dehumanization of clients, being pejorative of clients, stereotyping clients, allowing bias to enter the therapeutic relationship, blaming others, defensiveness, or an overuse of humor as a buffer to genuine emotions, withdrawal, isolation, workaholism, taking unnecessary risks, drug use or alcohol use and impairment can be a behavioral sign of burnout, and then unfortunately, suicide can be a symptom of burnout. On a micro level, why is it important for us to talk about burnout? Well, for one, we've talked about impaired performance and the impact that that has on our code of ethics. There's also individual health impacts. There's an increased risk for cardiovascular issues related to burnout. The highest incidence of cardiovascular mortality occurred when individuals' jobs were characterized by high demands, low amounts of control, and low social supports. And that was a fairly recent study repeated by Cooper, Wick, and Shabrock. Weight management and other related issues are also a consequence of burnout. There's increasing inflammation, blood pressure, metabolic abnormalities, so type 2 diabetes, increased lipids, which is cholesterol, and obesity. There's also a higher risk for smoking and other maladaptive substance use, as well as family and interpersonal issues. Burnout is associated with hostility both in the workplace and at home. There's also sleep impairments, which can impact all of those health risk factors. And then also, as we talked about in the previous slide, suicide is a major individual consequence of burnout. How about on the meso and macro level? What are the institutional consequences of burnout? Well, for one, there's higher absenteeism and tardiness. Increased stress leads to poor health consequences and thus increased absenteeism in the form of sick days, medical leave, which is very expensive for employers. There's also higher turnover, which is a major expense for organizations. Turnover impacts cost, efficacy, and continuity of care. So here's another impact to our clients. Lowered morale and job satisfaction, which is a major contributing factor to poor culture, which then also increases turnover. And of course, lower client outcomes. Individual burnout affects has negative impacts on the functioning of the team and is associated with lower productivity and poor quality of care to patients. Continuity of care is affected by absenteeism, turnover, hostility, and practitioners spend less time with clients. They take excessive and unnecessary risks in their clinical work. They express anger toward clients, other staff members, excessively blame each other and clients. Complain about the job to the patients. I don't know if you've ever been in that experience before. Nurses and physicians make more medication errors and have difficulty following orders. Poor charting, which is a major liability organizationally, and they become more inefficient at work. It opens us all up to lawsuits. So this slide is a diagram that myself and my colleague Carly Veloto developed the first time we gave this presentation based on the initial Maslach and Goldberg definition of burnout. So we have burnout, which is emotional exhaustion, reduced sense of accomplishment, and depersonalization. And our argument is that we want to do things that will increase energy, sense of efficacy, and involvement in the workplace. And that takes us from burnout to engagement. So what can we do about burnout? Okay, we've come to the slide, the reason you all are here. What can we do for ourselves? How can we take better care of ourselves? So my favorite book, The Resilient Clinician by Wicks, written in 2008, has a self-care protocol questionnaire for clinicians. And Wicks identifies the following items as vital for a good self-care protocol. And note that this is all of them, not just some of them. And he orders them in the opposite, I guess, so top down of Maslow's hierarchy of needs. So you'll notice that we go from basic needs like nutrition, sleep, and exercise to time management, which is important for reducing stress, reading, and he includes professional and leisure reading. And so both of those should be included. Alone time and time with others, so both, a balance. Spiritual practices or rituals, however you define that for yourself. Opportunities for professional development, so trainings, conferences, and then opportunities to process strong emotions. And for us as social workers, this usually means supervision and may also be therapy for yourself, seeking out a therapist who can provide you with support. Maslach and Goldberg also identified taking regular breaks from work and avoiding overtime, which is a really difficult thing for us in this field because often overtime means additional pay, which is sometimes vital because we are so low paid. Developing more realistic expectation and standards for yourself, incorporating relaxation strategies such as mindfulness, making improvements in your own personal health, such as reducing maladaptive substance use, losing weight, choosing healthy, nutritious foods. And I also tell everybody that attending to your own medical needs is vital for self-care. When I finally started going to my regular primary care doctor visits and seeing my podiatrist for my painful feet, my self-care improved dramatically. I was much healthier. Self-analysis is also important. You develop a better understanding of yourself and your commitment to the profession, which can help you seek congruence between your personal goals and values and the work that you do in your professional life. So when there's a disconnect between your own values and the work you do, there can a lot of times be dissatisfaction, which leads to burnout. And so we want to seek congruence. Self-care is not just care of self, it's also supporting others in their care. So what can we do for each other, our co-students, our co-workers, colleagues? We want to allow opportunities to share strong emotions related to work. Support groups at work or consultation groups. We have consultation groups in my work in order to support our colleagues through difficult cases and difficult emotions. Direct, respectful communications during interpersonal conflicts. There's going to be conflicts at work with coworkers, and dealing with those respectfully can help support one another so that workplace hostility is not a contributing factor for burnout. We want to seek and provide feedback and consultation with peers and supervisors. There's a back and forth. If you recognize symptoms of burnout in a peer, you can reflect this with authenticity and respect. Sometimes I handle this by speaking my truth about experiences with burnout and allowing them to observe any similarities or differences. We also have to respect peers' time off. We need to minimize communication with peers who are not on the clock about work-related things. No texting them at 8 p.m. wanting to talk about a work-related issue or sending emails while they're on vacation. And here's a slide for our future supervisors or our PPNA focused students. What can leadership do for their staff? A sense of autonomy and perceived capacity to influence decisions at work are associated with lower rates of burnout. So there's going to be some things that organizationally we can't compromise on, but the more autonomy that you can give within reason, the more effective you are in combating burnout on an organizational level. Gila Acker identified that organizational conditions like caseload sizes, pay rate, funding availability, autonomy, opportunities for professional development, social supports, role conflict, which is wearing too many hats, and role ambiguity, not sure which hat you're supposed to wear, and environmental safety all have a major impact on job satisfaction and intent to leave. Higher role conflicts and role ambiguity were statistically significantly negatively correlated with job satisfaction and positive correlation with intent to leave or turnover. Higher levels of social support from a supervisor and coworkers and opportunities for professional development and consultation were positively correlated with job satisfaction and negatively correlated with intent to leave. So they reduced turnover and increased job satisfaction and culture. And access to opportunities to process workplace stress or traumatic events with coworkers, leaders, or other professions. At MUPC, we have the 4U team. When there's a critical incident, the 4U team responds and holds a debriefing and refers for professional care if someone is experiencing primary trauma symptoms. A lot of workplaces have EAPs or similar things to help with debriefing. And here's a small list of local resources that we have here in Columbia. Not all of you are in Columbia, and I want you all to do your own brainstorming and use these as a jumping off point. So I mentioned the EAPs in the last slide. Here in Columbia, we have the ARC, which is our Community Recreational Center for low-cost access to gym facilities. On-campus students may have access to the student gym. Here in Columbia, we're fortunate to have the Career Center, which has hobby classes like cooking, baking, wine tastings. We enjoy taking swim classes with my toddler. So you can check in your area, see if there's any hobby classes or volunteer opportunities doing things you enjoy. So I want you to take some time to brainstorm your own ideas and share those with others. Be creative. Think about things that you've enjoyed prior to entering graduate school and see what you can do to fit those into your self-care plan as stated by Wix. And finally, over the next couple of slides, we have the references from the PowerPoint if you wish to check out any of these or do some primary reading on your own. Please also refer to the PowerPoints so that you can have those in a non-moving format.